Tonight we begin with the COVID pandemic. It hit the black community where vaccine hesitancy high, especially hard. I spoke with two black medical professionals who are among the first on the front lines in our state. When the COVID crisis exploded in Fairfield County in February of 2020, it suddenly became crunch time like never before for Dr. Funmi Falade.
Leadership in the time of COVID was challenging.
As chief of critical care at St. Vincent's Hospital in Bridgeport, Dr. Falade heads up the intensive care unit.
CBC with differential. BC? Yep, CBC.
She's in charge of 80 doctors, nurses, and other healthcare professionals here. During those early weeks of the pandemic, Dr. Falade was consistently putting in 18-hour days, 6 days a week, treating the sick. Many of those patients were people of color.
It was hard because the people who were serving were truly vulnerable in a different way. You know, a barber that in the midst of the pandemic is trying to make some money so his family can survive, and so would go to people's homes to cut their hair. And that would be how they get exposed.
About 20 patients normally receive treatment on a daily basis in the ICU here at St. Vincent's. But during the early days of the pandemic, that number often swelled to 50.
In critical care, one extra patient is a big deal because the one sort of swallows resources in a big way. The one swallows a whole nurse, a whole ventilator, a whole respiratory therapist, a whole set of devices. Every 6 hours, we have to change them out.
Doctors say there's no doubt that a person's outcome after being affected with the virus is connected to their vaccination status. That's why so much emphasis has been put on getting that message out to communities of color. Enter Keith Grant. He is the Senior System Director for Infection Prevention at Hartford HealthCare.
Misinformation was one thing that we had to address very, very quickly.
He has also become one of the most prominent public faces in Connecticut promoting the effectiveness of the COVID vaccine. In December of 2020, he became the first person in the state to be fully vaccinated.
The vaccine is safe. The vaccine is effective.
But there have been challenges getting that message out to some members of the African-American community, fueled by a historically based mistrust in medicine. Cases like the Tuskegee experiment, in which hundreds of black men died in a study of untreated syphilis, and the story of Henrietta Lacks, a cancer patient whose cells were collected without her knowledge and used for scientific research, have led to skepticism. That history has increased some people's concerns about the COVID vaccine.
We hear that people look at this as, if you look at the trials, the majority of people that were in the trials don't look like me, right? So how do I know this is going to work on me? So I think one of the first things is understanding where people are coming from.
Grant is also on the front line getting the word out about the vaccine. He's part of a team of medical professionals at Hartford HealthCare who have reached out to community groups since the beginning of the pandemic.
We started working with, faith-based institutions to include religious leaders. We started working with homeless shelters. We started working with different food banks.
All to educate people and ultimately save lives. Infectious disease expert Keith Grant and Dr. Funmi Falade, two Connecticut trailblazers in the fight against COVID.